Hello everyone. Today we are going to discuss about the most common question I am asked in the OPD about hair transplantation, and which is also the biggest fear of most of the patients. Will hair transplantation have pain? So that is the most common question I've been asked way many a times, not only during transplant but also during many of my consultations. So I'll briefly explain you the procedure of a hair transplantation and how it is done. So with that you will understand the pain that can be there during the procedure. Basically hair transplantations are done under local anesthesia. This local anesthesia, we do it in different forms. One is the field blocks, next is the nerve blocks, and with tumescent anesthesia. So what this nerve blocks or field block does is, we don't have to anesthetize the entire area what we are operating. For example, if we are operating almost in say 100 centimeter area, we just have to block only 4 to 5 centimeter wherever the nerve is going. So by doing that, we are actually reducing the number of times we are giving the anesthesia. This itself reduces the pain factor almost by 90%. And also in the anesthesia, what we try to do is we mix something called as a long acting anesthetic. So this long acting anesthetic will help you be pain free for almost 4 to 5 hours. And the best part about transplant is when we are doing the anesthesia, we try to use very small bore needles. That's called as almost a 31 gauge. That is a small insulin syringe, like how diabetic patients take the insulin daily. So these are the needles what we use, and we try to use a lot of vibration anesthesia and cryo anesthesia along with this to decrease the pain factor. And there are only two areas where we need to give the anesthesia. That is the frontal part, and when we are operating or when we are removing from the donor area, we need to remove it from the donor part. So these are only the two areas. Like if you're operating in a day, for example, for 8 to 10 hours, the painful factor will be like only for a maximum of 4 to 5 minutes. Beyond that, you will not have any pain. But we always warn our patients because scalp is a very huge area. There can be different nerve supplies in different areas. So sometimes if they complain of any minor pain, we try to give a booster in that area of anesthesia to overcome the pain that will be there. So this is about the pain factor during anesthesia. What happens post-transplant then? So post-transplantation is also a very comfortable phase of transplant. We give very minimal anti-inflammatory and painkillers which will take care of most of the discomfort that is there. And beyond like 4 to 5 days, you will not feel any pain or discomfort. You can do all your activities. You may feel a sensation of a heaviness on your scalp, which is quite common after an anesthesia, but pain, discomfort will be very minimal. Almost you can say just less than 0.1%. So this is about the pain factor in anesthesia. So if you have any other doubts related to hair transplantation, please do write to us in the comment section. Thank you.